This is the C. Jason podcast, and I am Kristen Nowak from the University of Colorado, here with my colleague, Heather Farmer-Bailey. We recently completed a randomized, placebo-controlled, double-blind trial testing the efficacy of 1 year of supplementation with the polyphenol curcumin for improving vascular function in 68 children and young adults with autosomal dominant polycystic kidney disease. Throughout this podcast, we will refer to autosomal dominant polycystic kidney disease as ADPKD for short.
ADPKD is a systemic disease, and in addition to affecting the kidney, cardiovascular complications are common, including vascular dysfunction. Curcumin is found in the Indian spice turmeric and has been shown to improve vascular function in animals and humans without ADPKD, as well as to slow cyst growth in a mouse model of ADPKD. There has been a lot of interest in the ADPKD community in curcumin as a potential non-pharmacological therapy.
Our co-primary outcomes were brachial artery flow-mediated dilation, a measure of health of the vascular endothelium, and aortic pulse wave velocity, a measure of arterial stiffness. We also measured changes in circulating and urine markers of oxidative stress and inflammation as secondary endpoints and change in kidney growth by magnetic resonance imaging as an exploratory endpoint.
Neither co-primary outcome changed with curcumin supplementation as compared to placebo. Additionally, there was no reduction in vascular oxidative stress, no change in biomarkers, and no slowing of kidney growth with curcumin. A notable limitation was that participants in the curcumin group had lower adherence to the supplement than the placebo group, and that we were unable to assess circulating curcumin levels. However, the solid lipid curcumin particle we used significantly raises plasma curcumin levels as compared to traditional formulations.
Overall, our results indicate that curcumin supplementation does not improve vascular function or slow kidney growth in children or young adults with ADPKD.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.